It's no secret that little blue pill has done wonders for many men's sex lives. But what about women with waning sex drives? Pharmaceutical companies have been searching for a little pink pill ever since Viagra started flying off the shelves 15 years ago. Now, the wait could finally be over. A new FDA-approved drug, Asfina, is making headlines from the Los Angeles Times to Newsweek. But what exactly is this so-called pink Viagra? And is it right for you? Asfina isn't actually pink. It gets its nickname from the media buzz claiming it can help women who want better sex lives. In particular, the 50 million American women who've hit menopause. Asfina claims to ease the painful intercourse that often occurs in postmenopausal women. So, could Asfina do for women what Viagra has done for men? Will this little pink pill bring the heat back to your bedroom?
I asked all the women in my studio audience when they first arrived if there was a pill that could help your sex life, like Viagra, for example, does for men, would you use it? Without knowing anything about this pill, 47% of you said yes. Almost half the audience. So here to discuss today's breaking health news is sex and relationship expert Dr. Laura Berman and ABC News senior medical contributor and OBGYN Dr. Jennifer Ashton. So let's start with the basics. Laura, Asfina, what is this? How does it work?
This is a prescription medication that's been approved for menopausal women who have vaginal atrophy. That's thinning and tightening of the vaginal walls. They'll have pain, often have pain and dryness with intercourse. And so this is a medication that has that indication, brand new, FDA approval.
Jen, you're busy practicing, and I'm sure a lot of women are coming to you with these complaints. Do you think this is a breakthrough for women who have, postmenopausal women who want better sex?
For those who have painful intercourse and it's affecting their sex lives and therefore their everyday lives, I think any time we have the opportunity to put attention on women and their sex lives, that is a good thing. This is something that, you cannot turn on the television without seeing 2 bathtubs and a field of flowers for men, but the same thing does not exist for women. So I think that we're making baby steps in bringing that to the forefront of our awareness and dropping the social stigma that comes along with it, and that's
Absolutely.
a good thing.
So Martha, she was walking up the set, asked if Asfina would replace sex or just make it easier. So Laura, as a sex therapist, can this pill help restore libido, sort of get you in the mood?
Indirectly, okay? So this is not going to be a magic pill. Our main sexual organ for everyone, but especially women, is between the ears. It's your brain. It's how you feel about yourself, your partner, your relationship, your body. It's many things, right? But for those women who are avoiding sex because it's painful due to dryness and burning with intercourse, this might help because now they're going to have potentially less painful intercourse. Also, sex begets sex. If you don't use it, you lose it. So the research has definitely shown that when women are more sexual with their partners, not only does it keep the plumbing clean and they have more blood flow to the area and more lubrication overall, but their relationship is better. Their connection to their mate is better, and then they're that much more inspired to be sexual moving forward.
So Jen, please, for everyone to be clear on this, explain how Asfina, this new pill, is different from Viagra, the medication you guys all see men taking for arousal issues.
Well, Viagra is a wonder drug because it works very simply and very effectively, as Laura said, on the plumbing in the male sexual organ. It increases blood flow, and when you do that, you're good to go. Women, much more complicated. So Asfina is what we call a selective estrogen modulator. So it works like a hormone, targeted in a very choosy manner, just in the tissue in and around the vagina. So it reinvigorates that tissue so women don't have pain with intercourse, but it doesn't have the estrogen or hormonal effects elsewhere in the body. So it appears to be very effective in working just where you need it to work, which is the vagina.
So let me, if I can, show everyone exactly with an animation what you're saying, because it's critically important. I'm going to come back to this comparison to Viagra. So if you look inside your body and you take this pill, as an example, you pop it in there, and it does a bunch of things. But they are all focused, as Dr. Ashwin was saying, not in the rest of the body, but specifically here in the uterus and the vaginal area. So inside the vagina, as you get older, the tissue begins to dry. The blood vessels, they begin to shrink back, and it becomes uncomfortable. This medication opens up those blood vessels, allows this tissue to pink up a little bit. It allows it also to lubricate more effectively. With more blood supply, this will happen naturally. And in addition to the lubrication, there's one other thing that happens. Over time, you literally will thicken the wall up a little bit of the vagina that makes the tissue stronger, which can help with so many women who are having discomfort, especially as they go through menopause. So because this pill mimics estrogen, there are some appropriate concerns that just like other hormone replacement therapies, it might actually affect you adversely. So, Jen, concerns?
You know, if a woman was having hot flashes, Mehmet, because she's going through menopause, Asfina would not be recommended for her. So this is not the typical HRT or hormone replacement therapy that in gynecology we give for women suffering hot flashes or any other number of menopausal symptoms. But remember, Viagra, men take the day of or a couple of hours before sex. Asfina, you have to take it every single day because it takes time for what you just went through to happen from when you swallow that pill to when the effects actually can be seen or felt in the vagina.
Jen, you got to make a decision in your clinical practice. Would you prescribe this to your patients?
You know, Mehmet, I would go over with my patients and with women who are listening what the risks, what the benefits are. Yes, it's an option, but like any medication or any treatment, even if it's natural, by the way, there are risks and there are benefits. The risks seen with Asfina when they tested it were about 7% of women had hot flashes, increase in urinary tract infections, vaginal discharge, sweating, and because it can act similarly to a hormone, there can be an increased clotting risk. So you have to go through those risk profiles with a woman, and then I always very big on recommending options and alternatives. And I personally think there are better options and alternatives to treat vaginal dryness.
Well, we have a couple here. I'm going to share them with the audience. These are options that we could use in lieu of the pill. Jen, you recommend estrogen cream.
Yeah. So, you know, this is something that you do need a prescription for. It comes in synthetic or bioidentical, which is plant-based formulations. And estrogen cream or pills can be inserted just in the vagina.
And when you're saying pill, it's a pill that's inserted into the vagina,
right? Oh.
That adheres to the walls and dissolves there, so it's not as messy as the cream.
All right, but you both seem to like coconut oil.
Oh,
yeah,
we're
we
both
love
big
it.
fans of coconut oil.
Why is that?
I mean, well, first of all, this is a wonderful, completely natural lubricant. I mean, I use it as a moisturizer. I cook with it. I got a big tub in the kitchen and a big tub in the bathroom because I put it all over my skin.
Yes. It's like a pina colada every night.
It's a pina colada every night. And it smells great. It's all natural. It works wonderfully. Women love it as a lubricant. And it's got no side effects, only healthy properties.
Right.
All right, so here are my final thoughts. If you are postmenopausal and suffer from vaginal atrophy, there are some less messy options available now other than these creams, which make a lot of sense. And the pill might be a good choice for them. But for everybody else, this is not a cure-all for libido problems. So if I were you, I'd go for the coconut oil with one of those pina coladas tonight. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.